Hi, my name is Charis Fields, and I would like to discuss my client, Darren Jones. He is a 47-year-old African American male, and he is currently homeless and has some medical issues where he's now seeking Social Security disability because he's unable to work daily. I'm using the Ecomap approach from a strength-based and person-centered perspective. This will give the client an idea of the support systems that he already has in place and then the ones he will also need to work on. Hello, Mr. Jones. Thank you for joining me. I am working with you today by using an Ecomap, which serves as a visual connection to your social environment. It will also highlight areas that you may um, be lacking in. And this can help you further process where you can improve socially in terms of support, community engagement, and other social service programs. So we can get started, and we did go over some things initially, and we can just look at them now to see, to discuss these areas. So right now we're going to start with family. It shows that it is weak and strenuous. You have an ex-wife and two children. So you and your ex-wife have recently gotten divorced after 25 years of marriage, and your two children you're not currently speaking to. So I know that this is the divorce has was very strenuous on you and not being able to speak to your kids. So that's why we have those dotted lines there. Next, we have your medical, which is also strenuous because what you've told me is that you were diagnosed with lupus in 2019. And that not only came as a shock, but it also affected many other areas of your life, in your family and in your work. And it's just stressful to you to know that that part of your life is the medical part of your life has really taken over. Next, we have work. So, work, you were an ex police officer, and your precinct did as much as they could to try to keep you on. You said a few months shy of retirement, but because you continue to pass out and have seizures, and it became worse, that they were not able to allow you to stay with the precinct. And even though we have a strong line here, we also have um, a strenuous line as well, because even though they gave you support, you lost your livelihood. You were no longer able to do the thing that you enjoyed the most, which was being a police officer. And I can see how that could be strenuous as well. We also next have therapy on your eco map. I'm sorry. And with therapy, we have that as an energy support. Um, you've shared a lot of in therapy, and you have been able to gain a lot of perspective from your therapy sessions, which is a resource in where you are right now. So we'll cover that. But in therapy, you've been able to discuss how you felt about your family, you feel like they have betrayed you because of your illness, which has currently um, got you into the homeless situation that you're in right now. Next, we have friends. So you have a few friends that were ex co-workers at the police precinct, and you've also made some new friends through the Lupus Foundation. And even where you reside right now, you've met one or two people that you felt that you could speak with on a different level. And so I have reciprocal line right here because you have been able to confide in certain people, and they've also been able to come to you even in the midst of your situation. Next, we have legal, and we have that as distant and a strenuous type of relationship. So, not only as we go back to family, you and your wife, after 25 years, went through a divorce this year, but you also are undergoing and applied for Social Security disability. It's been that way since 2019. You were denied. And I know that's kind of strenuous because you want to actually work, but you're not able to because of your health condition. And so you're still waiting on a determination. You don't have any income, you're unable to work. So I can see how that relationship with the legal aspect of everything can be very strenuous to you. Next, we have social services. So, currently, you are living in a men's shelter, which is a job readiness program. So, you do have that as a energy type of relationship because you stated before that this is one of the nicest shelters that you've been in. And with this program, even though you're not able to work, they've allowed you to still use some of the resources where you were able to get SNAP benefits. You were able to sign up for the free phone service. Um, you were able to go get um, a free eye exam, free dental work, free checkup, with the resources that are available through the shelter. And you have stated that being able to do that has helped you a lot because you still want to keep track of your health and even other aspects of your health as well. So that is why we have that energy line there, which has really helped you, what you said. But I guess we could also add the a line where it is reciprocal. Let's see if we can do that. Okay. Yes, because you did state that because you have been in law enforcement, because you are active in the community, that you wanted to also give back in that shelter where you reside temporarily. And that's the good thing, to know that even though the services and the resources that you have is giving you that energy, you want to put back forth that to be able to help others, especially in the midst of your circumstances. And next we have church. So we have a distant um, relationship with church. You were years ago, you stated were actively involved in church, and right now you feel that there um, that you're not active right now. You did share a bit about when you were working and you felt like you had reached a certain level and you weren't giving the glory to God. You stated that you felt like you deserved everything that you had because you worked for it. Right now, you stated that your perspective is different and that you, even though your relationship with the church and with God is strenuous and distant, you are willing to make an effort to get back into church and work on your relationship with God so that things can, you can have a more positive outlook on your situation at this time. So we, after going through everything, we see that you do have support systems out there more than you realized. I know that you were focusing majorly on your family and how you felt betrayed, and that you felt like you couldn't really turn to anyone for any type of support. And so, after going through this eco map, we see that you've made some strong supports when you were working. You do have friends, even though they may be few. You do have friends out there who care about you, who care about your well-being, who want to see you to continue to succeed, even if it's in a different way. Um, the social services, because you're living in a shelter, you still have connected with a person or two that gives you encouragement, as well as you've been able to give encouragement as well, to other individuals that are in the same or a worse situation than you are. And we have the social club, the Lupus Foundation that you're a part of. You have been able to um, get your diagnosis, and you found out more about the diagnosis that you had, and you turned it around. You became more active in the community, um, not only gaining awareness for yourself, but going out and explaining what lupus is and how others can help that illness to other individuals, as well as helping to try to raise money for the organization as well. So we see that just by looking at this eco map, that you have already some supports in place. And I know that you want to potentially work on increasing or changing the other support systems that you may have or that you lack. So we're going to put a date on here. So as of September the 18th, 2022, we will revisit this. And as you continue to work on things and as you continue to um, gain perspective and continue with therapy and um, increasing those positive supports, that we'll revisit it, and hopefully the support systems that were strenuous or that was distant will have changed and have a thicker line, or just even if it's just one-sided, that you would have gained some type of increase from today until next time. So thank you for allowing me to work with you, Mr. Jones. And I hope that as we continue to work together, we can help assist you in the direction that you would like to go in. Currently, you're homeless, but we are looking to change that situation for you. And thank you again for working with me. All right. Bye bye.